having HBCU graduates from colleges of medicine in health systems in leadership roles in health system are spaces where decisions get made and therefore can influence the way we practice medicine and the way we co-create with our communities.
What role do HBCUs play in improving health equity and building anti-racist health systems?
Well, we play a foundational role in that because all of our missions have been founded because of that desire to promote health equity. So I feel that our medical schools are rooted in community. They actually research topics related to social determinants of health and health disparities and other topics that are important to communities that we serve. We provide care to under-resourced communities that are traditionally left behind. And we provide community service that's partnered with communities, not just thrust on them. I feel that all of our institutions have allied health professional training opportunities in addition to medical education opportunities. So we're really a place where health equity is demonstrated.
Yeah, just our role in producing a lot of Black and brown doctors that go out into the community. They're more likely to serve the community than everybody else. And they go out not just to serve the people, but into spaces, professional spaces where they influence policy, culture, direction of different types of institutions. So we as a collective play a huge role in that.
So Leo, I want to have you to add on to that, number one, but knowing that you're from a newly developed partnership between a health system and HBCU in delivering training and education in medicine, can you talk about what role you believe that you're playing now as a part of that process?
Well, at HBCUs, as Marjorie said, it trains minority physicians to be in spaces. And I love when she says that. And some of those spaces are practicing medicine in large health systems. As we know, independent practice physicians, about 10 years ago now, we have more employed physicians than we have independent practice physicians. Both spaces are important to delivering care, but it's where decisions get made and therefore can influence the way we practice medicine and the way we co-create with our communities.
Tabia, I want to ask this question particularly to you. What can advocates, health systems, and others learn from HBCUs about serving and engaging communities, especially historically excluded and underserved communities? Can you give us some of your perspective on what people can learn from HBCUs?
What we bring is the courage to understand that relationships and benefits by default should represent multi-directional value. I think our roles as HBCUs and what they can learn from other organizations can learn from us is that the community residents, community-based organizations, they're not fraught solely with needs, but they represent strengths without which we cannot be as effective in providing culturally, not just competent, but culturally humble care that is responsive to the strengths and the existing power that we need to leverage to be better institutions, to produce better clinicians that are poised not to just lead, but to also be led by the perspectives of patients as well as community residents. So I think the values that we talk about in our missions, we uniquely practice those by positioning community leaders and patients as central to our success. I think the other part that we demonstrate is trustworthiness, which is a term that lots of folks are using right now. That is not just a concept. I think everyone wants to say they are trustworthy, but that practice requires courage.
Look, my 25 years of practice, I've seen an incredible erosion of trust for the physician. It used to be you put on the white coat, and you got instant trust from your patients. That is just not the case. And then for the minority communities, there's a lot of reasons for minorities not to trust the health system through multiple examples. I always think of Francis Fry's trust triangle when I think about building trust, that you have to have authenticity, you have to have empathy, and then you have to have the knowledge too. And you need all three to build that trust. I think HBCUs at the forefront of training physicians that can earn that trust from the community because they're training in the communities that we would like for them to serve is a key component to that.
For more conversations like this, subscribe to our YouTube channel and learn more at meetattheintersection.org.